move on to the psychology that's being investigated in this study. The main psychology that's being investigated is evaluative learning, which is a form of classical conditioning, which is learning by association, right? This is when an individual evaluates a previously non-threatening or a neutral object negatively without anticipating any threat or danger. This leads to that individual eliciting the fear, eliciting the emotion of disgust rather than fear, or it can also be disgust along with fear, right? Um, so let's move on to the aim of the study. The aim of the study is to look into the role of classical conditioning in phobias. They also wanted to know if using a specific type of exposure therapy could help to reduce the phobia. And also, the researchers were very inclined to put these issues forward, the issues of the lack of, um, research done on disgust as an emotion. As disgust is a very important emotion which plays a role in the exasperation of phobias, right? So they wanted to put out those issues through this case study. They wanted to raise awareness that phobias do not only mean fear. The emotions that are associated with phobias are not only fear, but it's discussed as well, right? So, and this study is like a very special kind of case study, as it is a clinical case study. So not only we are researching on the boy, not only we are trying to gain as much information as we can about specific phobias such as a button phobia, but also we are trying to look into different ways in which we could treat the boy. So let's moving on to investigate the role of classical conditioning phobias. Classical conditioning is essentially learning by association. It's like an unconditioned response get conditioned with a previously neutral stimulus to create a learned association, right? So let's take the example of the Pavlov's theory, Pavlov's case study that he did on his own dog, right? So at first, our in this case study, our conditioned response, unconditioned response is salivating, right? When you present a dog with food, he's gonna salivate because obviously he's going to be hungry looking at it, right? So that is our unconditioned response in this case study. The dog is salivating looking at the food. And the neutral stimulus in this case study is the bell, because a neutral object is specifically like known as the object that does not elicit an unconditioned response, like it does not elicit any response at all, right? But when we see and our unconditioned stimulus was the food, right? Food is basically the object or the stimulus that elicits some kind of response which is salivating, right? So at first, Pavlov presented the dog with food, he started salivating, all right? Then Pavlov presented the dog with along he rang the bell to the dog, right? And then what he did is that he rang the bell and he presented the food to the dog at the same time, right? And he repeated this process along like 6 to 7 times a week, or like over a long period of time, until he is sure that okay, maybe it's time that he has learned this response, right? So he keep repeating this over a long course of period, and then whenever the dog would hear the bell ring, he would start salivating. Why? Because he associated that bell with the food, that he associated that okay, the food is now going to be presented to me, right? So now this is a conditioned response. This is a learned association now. All right. So let's move on to the participant of this case study. The participant is a 9-year-old Hispanic boy. He presented at the Child Anxiety and Phobia program at the Florida International University in Miami. His mother and his mother gave her complete informed consent for the write-up of this report and it being published when this case study finished. So let's keep that in mind for our ethics, as informed consent was taken into account, and yes, this study was completely ethical in those terms. So the ADIS schedule was administered onto the boy and he met the DSM-4 criteria of a specific phobia of buttons. For those who do not know what DSM is basically like a manual, a diagnostic manual, which has a list of symptoms written down. So when a person checks off all those symptoms, so there's a certain criteria set, like you can have a very minimal phobia or a very excess a phobia of like a very to a severe extent. So right now DSM-5 is in fashion and that's being administered, but in those times DSM-4 was there. So he met the DSM-4 criteria of specific phobia of buttons. So the research and the data collection method is basically, like I told you guys before, it is a clinical case study. Clinical case study, why? Because it's being done on one boy. His life is being studied in depth. His phobia is being studied in depth. And clinical because we are also treating him at the same time. We are also looking into different procedures that could help to reduce the distress that's associated with his phobia of buttons. We are looking into we are administering the self-report method, as we are using semi structured interviews to obtain data from his mother and the boy himself, right? And they also conducted observations of the boy, which were, I believe, during the interventions when the therapy was being conducted, right? Okay, so the procedure, let's move on to the procedure of the study. When the interviews were being conducted, the boy described the onset of his phobia. His phobia started when he was a 5-year-old boy and he was in his art class. He ran out of buttons to paste on his poster board, so he called out his teacher, and his teacher invited him to her front desk, which was at the very beginning of the class. um, there was like a very large bowl just set on the teacher's desk. He reached out his hand towards the bowl, but however, the large bowl fell on him, and like these hundreds of buttons just fell on him. He described this experience as distressing. Like he felt disgusted, he felt distressed. So his mother reported that during the early years of the when this incident happened, around that time the symptoms were pretty low. It wasn't that as bad, but as time went on, his avoidance and his distress associated with phobias increased to a great extent, because he could not even dress himself, or he could not even concentrate in school, perhaps because he was always occupied with his shirt, and like what um or what his button shirt touched. So he was very much occupied with that, so it led to a lot of um difficulties in his life, right? So then the researchers were also careful in ruling out any other adverse events in his life, such as sexual, child abuse, um, or physical abuse that any child could have experienced in his life, like after the onset of his phobia, as he described in his classroom. The researchers were careful in ruling out any other events in his life that could relate to the onset of the phobia, to make sure that we are not leaving out anything else, or we are not like leaving out any other important event in his life that could have caused this phobia, right? To make the research internally valid, to make the treatment that's going to be administered on him completely valid and effective, right? So the researchers were very interested in knowing, um, like his specific feelings towards specific buttons, right? Because obviously he's not going to be scared of every button equally. There are going to be variations. So along with the researchers, the boy created a hierarchy of fear stimuli, right? So here you guys can see a hierarchy of fear stimuli. Now, each stimuli on this list is provoking increased fear, right? He gave large denim jeans buttons a rating of 2 out of 8, but small plastic buttons an 8 out of 8. So it was a 9-point feelings thermometer. The most difficult form of buttons for him were the small plastic buttons, and the most difficult task for the boy was touching someone or handling these buttons, touching someone who was wearing these buttons. It was the most unpleasant and the most difficult task for this boy. All right.